Hi and Assalamualaikum. I'm Atira binti Muhammad Asli. First of all, I want to thank Madam Hidayah for giving us opportunity to present. So we are choosing the topic which is hand, foot and mouth disease (Hfmd) in Malaysia. So this is my group members, which is me, Atira binti Muhammad Asli, and my friends Nur Atika binti Yusri and Marsha Humaira binti Abdul Ghafur. So what Hfmd? So hand, foot and mouth disease is contagious disease that is caused by different viruses. It is more common for people to get Hfmd during the spring, summer and fall months. It usually affects infants and children under 5 years old. Occasionally, adults will also get the disease. Symptoms of hand, foot and mouth disease include fever, painful blister like sores in mouth, and a rash that may appear as blisters. It is usually a mild disease and nearly all infected people recover in 7 to 10 days. So this is the symptoms of Hfmd. The first one, mouth sores, which is children can get painful mouth sores. These sores usually start as small red spots, often on the tongue and inside the mouth, that blister and can become painful. So the second one, skin rash. Children can get a skin rash on the palms. We can see that. Can get a skin rash on the palms of the hands and soles of the feet. It can also show up on the buttocks, legs and arms. So the fluid in the blister and the resulting scab that forms as the blister heals can contain the virus that cause hand, foot and mouth disease. So the third one is fever and flu-like symptoms, which is children often get a fever and other flu-like symptoms 3 to 5 days after they catch the virus. That's all from me, so I will pass to the next person for the presentation. Thank you.
Assalamualaikum and a very good day. My name is Nur Atika binti Yusri, and in this video I will present about the causes and the diagnosis of Hfmd. So hand, foot and mouth disease is caused by the viruses that belongs to the enterovirus family. There are 3 types of virus that cause Hfmd, which are Coxsackie virus A16. This virus is typically the most common causes of Hfmd in the United States. Next, we have Coxsackie virus A6, which also cause Hfmd, and the symptoms on the patients may be more severe. Lastly, we have enterovirus 71 or EVA71, which has been associated with cases and outbreaks in East and Southeast Asia. Although these viruses are rare, but it has been associated with more severe disease such as encephalitis. For diagnosis, healthcare providers or doctors can usually tell if someone has hand, foot and mouth disease by examining the patient and also considering the age of the patient, like how old the patient is, and the symptoms that the patient has, and how the rash and mouth sores look like. Sometimes doctors may collect samples from the patient's throat, blister and feces, and do a lab test for the virus.
Assalamualaikum, my name is Marsha Humaira. So I will continue this presentation with topic of treatment. So the treatment for Hfmd disease, actually there is no specific medical treatment for this disease, but there are steps that can take to relieve symptoms. Firstly, we can use paracetamol as directed for fever and any discomfort. Offer plenty of fluids but avoid orange juice, which is acidic and may cause pain with mouth ulcers. Next, allow blisters to dry naturally. Do not pierce blisters as the fluid within them is infectious. And consult the doctor if a child of Hfmd complains of severe headache or any worrying symptoms. So next is prevention. So how to prevent Hfmd? There are some of the way to prevent Hfmd. Some of it is wash hand often, avoid close contact with infected children, cover your mouth when you cough or sneeze, keep utensils, toys or other things used by infected children separate, clean and disinfect contaminated surfaces. So the conclusion of the Hfmd disease is Hfmd is once considered a disease of cattle has been emerging as a common human childhood disease in the last few years. So the incidence of this disease increases every year. Though in most of the cases it is non-fatal, there are some reported cases of complications seen in Hfmd patients. So we know Hfmd by the symptoms such as fever, skin rash with red spot or lost appetite. So this disease has no specific treatment, but there are steps to relieve symptoms such as use paracetamol for relief from fever and headache. So these are the references that we use to complete this case study of Hfmd. Thank you to hear our presentation.